And the whole purpose of an institute like this is to move research from either the laboratory concept into human trials, or from human trials into the community, to disseminate it into the community so it becomes a part of practice. And that sounds like a simple concept, but it really isn't. And part of the reasons it's not is because it requires people with very different backgrounds. It's not one person that can move through each of these steps. And so the ITHS is really almost like a developmental engine to help investigators think beyond their laboratory or their clinic or their own community, to think about how do we work together and move either drugs or devices or new diagnostic tests forward for the greater good of the Northwest. The greatest challenges with translational research is that it can't just be one individual. It requires a person getting into often an area that makes them uncomfortable, which is moving beyond their area of expertise, bringing in other people. For example, if you're a laboratory scientist and you find something that works in the laboratory, that doesn't mean that it's going to work in the human, because you have to make sure that you can make the drug, that it's safe, that it gets absorbed into the body, that it's financially practical, and that you can make it in some sort of form that people could actually take it. So ITHS is made up of a very wide range of faculty itself. That's what it is. It's not just people in one area, and it's across the Pacific Northwest and certainly within the university. And so these are individuals that often have worked on developing drugs or other therapies who are, teaching and mentoring and helping other investigators. So for example, someone comes forward and they say, I have this new idea. What the ITHS can do, first of all, it can show them where they could get funding to work on it, whether it's pilot funding or help in submitting to another granting agency. There are educational programs. If you don't know how to work with the FDA or a regulatory body, there's someone that can give you instruction on that. It's also a big connector. So you might need help from someone, as I said, in engineering. They'll link you up with that type of person. There are advisory boards where you can present your work and have renowned scientists review it and say, I think you need to take this direction, or you're not really ready to go forward. You need to go back and rethink it. So it's just a multitude of ways. That's what's so wonderful about it, is it can personalize it. I mean, if it were just generic, you could go to a website, but it's very personalized and it helps that investigator move forward. Well, my hope, and the reason I got into the ITHS, so I had this wonderful experience as a fairly young investigator of having an idea of how I could help a family or a patient, and actually seeing that happen. That if every young doctor could experience that, that would be wonderful. That every young doctor coming out thinks, how could I help somebody with whatever disease they're working for? And if they could experience that, that would be wonderful. And so that's why I became engaged in the ITHS. How can I help that happen for others so that they can come and feel safe and say, you know what I really want to do? I want to develop this new vaccine. And this is my idea. And they can find a mentor, they can find classes, they can find resources that'll either tell them this isn't the right way, you need to take another route, or can help them be successful.